it's not just about prescribing a patient with a personal mobility aid. It's also about ensuring they know how to use it safely in their daily lives. To do so, occupational therapists first need to assess how strong the patient is, how far they can walk, and how well they can balance. These therapists will get updated guidelines in line with new laws kicking in next year. Tan Tock Seng Hospital sees up to 20 people at its occupational therapy department every week.
We look at their past medical history, and then we also look at their physical condition, and if they have any cognitive impairments that may prevent them from safely operating a device. So following that, right, the occupational therapists will usually provide training for this individual to actually ensure that they are competent in operating the mobility device before we actually prescribe them with the device.
Okay, Cheryl,
Meantime, this doctor checks patients' vital signs and stability to assess if they need a mobility device. But he says other doctors may have their own criteria. And the form he has to fill in for a patient to receive a subsidized PMA only has 3 questions.
At this point in time, it's really up to the discretion of the doctors. Yeah, for the future, we hope to have better clarity and the government come with guidelines to help us GP to certify patients if they are fit for PMA or not.
The Transport Ministry says it will announce more details on medical assessment for PMAs in the 3rd quarter of this year. Authorities say users who have subsidized mobility scooters will be exempted. The government will also keep a record of those who already have the certificate. When the new rules kick in from next year, users will either have to produce a digital or hard copy of the certificate when approached by enforcement officers.